Good morning. My name is Ariana Gover-Chamlou. I am a recently graduated fourth-year medical student from Rutgers Robert Wood Johnson Medical School in New Jersey. And today I'll be making the case to include standardized patients with disabilities in medical education. This project was supported by the Rutgers Robert Wood Johnson Medical School, and my faculty advisor was Dr. Carrie Caulfield with the Department of Pediatrics. Nearly a quarter of adults in the United States are living with a disability, and 1 in 6, or 17%, of children aged 3 to 17 years have a developmental disability. Studies have shown that individuals with disabilities are twice as likely to report that their healthcare is inadequate to meet their needs, 4 times as likely to report being treated badly by healthcare providers, and more likely to report that doctors do not listen to them, treat them with respect, or involve them in clinical decision-making. This raises the question, how are we preparing medical students and healthcare professionals in general to care for patients with disabilities and address these disparities in care? The purpose of my study was to assess the need for additional disability-focused education at Rutgers Robert Wood Johnson Medical School in 2 parts. In part 1, I designed a 19-question survey to assess medical students' attitudes, experiences, and interests in additional educational opportunities about disabilities. The survey included open-ended questions asking students to define disability, recall significant learning experiences about disabilities in medical school, and describe their ideal learning environment. Multiple choice questions were created to gauge student attitude toward, prior experiences with, and preparedness to care for this patient population. These survey questions were designed following a systematic review of published instruments on attitudes about disabilities and tailored to the educational curriculum at Robert Wood Johnson Medical School. In part 2, survey results informed the design of a clinical teaching module with the goal to increase student comfort and preparedness to care for patients with disabilities. For the purpose of today's talk, I'll focus on the results of part 1, the survey. I was able to survey 137, or nearly 20%, of eligible students at Robert Wood Johnson Medical School, with fair distribution across the 4 different classes of students. For the purpose of time, I'll focus on only a pertinent subset of the results of the survey. A majority of students, nearly 70%, have had prior close personal experience with individuals with disabilities. When asked whether they have a good understanding of what it's like to live with a disability, 37% of students disagreed, and 29% were uncertain. When asked whether they would be able to live a fulfilling life with a significant physical disability, 44% of students agreed, and 39% were uncertain. When asked whether they would be able to live a fulfilling life with a significant cognitive disability, 47% of students were uncertain. When asked about their exposure to disabilities during medical school, the majority of students experienced occasional or sparse exposure, with 49% reporting occasional exposure and 25% reporting sparse exposure. When asked whether they feel prepared to care for patients with disabilities in future practice, 59% of students report feeling somewhat prepared. And I took a look at the subset of students closest to graduation, the 4th-year students who are about to graduate from medical school and go on to residency, where they will have more independence in practicing and training. And of those 4th-year medical students, 72% feel somewhat prepared, and 12% feel not at all prepared to care for patients with disabilities. However, overwhelmingly, 96% of students plan to care for patients with disabilities as part of their future medical practice. And here is a breakdown of preparedness to work with patients with disabilities by class year. I'm paying special attention to the charts in green, indicating the students who are closest to graduation, who have fulfilled the requirements of medical school education, and the majority of whom are feeling somewhat prepared to care for this patient population. Ideally, we'd like to see more of the students in the yes category, or at least none of those students in the no, not feeling at all prepared category. We also asked students to rank their preferred learning experiences, and students did preferentially rank learning experiences that offer the opportunity to practice interviewing and examining patients, more active learning experiences, as well as those that offer the opportunity to discuss an individual's real life experience living with a disability. These were ranked choice style questions where students could rank the learning opportunities that they would feel are most helpful to their learning style. The most helpful experiences, those top 3, are the most active learning experiences experiences, direct learning from a hospital clerkship or elective rotation, faculty-led workshops where they get to interact with individuals with disabilities and learn about their real life experiences, and physical exam training that is specific to disabilities. The implications of these results are that active learning experiences that involve individuals with disabilities would help students prepare to care for this patient population. The goal was to come up with an active learning-based exercise that would reinforce positive attitudes about disabilities, improve understanding about what it is like to live with a disability, and increase preparedness to care for these patients. I therefore propose the integration of standardized patients with disabilities into the medical teaching curriculum at Robert Wood Johnson Medical School through a clinical workshop that involves interviewing and examining standardized patients with disabilities, followed by a discussion of the individual's real-life experiences and perspectives on disabilities. So what is a standardized patient? This is a practice that is already well established in all medical schools. An individual, typically an actor, is trained and compensated to portray a particular illness or problem based on an actual medical case. Exercises with standardized patients allow medical students to practice clinical skills and receive immediate feedback from evaluators. Typically, these experiences are scripted by faculty, and adults with disability are currently not recruited for these exercises at Robert Wood. However, many medical schools, as part of their longitudinal learning curricula about disabilities, have recruited and compensated adults with disabilities to portray a standardized patient for learning purposes. Studies have revealed that learning experiences led by individuals with disabilities have the greatest impact on students' knowledge and attitudes. So why include individuals with disabilities as opposed to training the actors that medical schools already recruit to portray a disability? Well, the inclusion of standardized patients with disabilities in medical teaching allows students to learn about the lived experiences of individuals with disabilities, which studies show have the greatest impact on their knowledge and attitudes. The use of simulated clinical encounters with standardized patients with disabilities gives students the opportunity to practice skills and build confidence in a safe learning environment, in an exercise that has authenticity and credibility, in which students are learning directly from the population they plan to serve. Further, involvement of the disability community in training and education efforts is considered essential to the disability rights movement, embodied by the conviction of the movement, "Nothing about us without us." A special thank you to my faculty mentor, Dr. Carrie Caulfield, from the Boggs Center on Developmental Disabilities and Department of Pediatrics, and thank you for allowing me to speak today.